Then let's get started. Thank you for joining us for our early stage research group. This is part of our webinar series. So today we'll be having a guest presented, but before we do, I wanted to go through a couple of action items. And this is meant to be for early stage researchers. We're helping people who are just getting started in their career or just they're new to OHDSI. And the biggest message we want you to know is that you do not need to walk alone on your OHDSI journey. There are several thousands of people that are on their OHDSI journey, and we like to team up and we like to partner with things. And I had a few things for you. One I would recommend is, so some of the new, I want to give you some tips and tricks as a new member or as new to OHDSI is, you'll find that we've got a lot of papers on PubMed. We've got a lot of videos on YouTube. As a matter of fact, I started getting to know more about OHDSI through YouTube is how I became more acquainted with it. We have actually these great learning management courses in Eden Academy, as well as we've got 28 working groups for you to get involved with folks. And so I wanted to demystify and share with you how to get involved with OHDSI a little bit. My first tip that I want to give you is go to this website, dash.ohdsI.org, and look at either our videos or our publications or our Eden courses. And what you'll find in each of them, you'll find the ability to sort them by how many times they were viewed, how many times the courses were completed, or how many times the manuscripts were cited. That's a great way of seeing what are the most popular publications or most popular videos or most taken Eden courses. And that's a great place to get started. So just watching some of the most highly viewed videos is a great indicator that this is a good piece of material for you to learn about. And so I just think it's a nice little tip to figure out how to get started in understanding different pieces of the OHDSI ecosystem is to use using some of our dashboarding tools to help you see all the different pieces of it. Of course, you'll also see things that are happening. You can look at sort by date published, and you'll see things that are happening right now or very recently. And so you can kind of see, you can also stay up with it as well. So a lot of people that are with OHDSI use these tools just to keep up with all the things that are going on within the OHDSI community. So that's my first tip for getting into OHDSI, is just going in there and taking a look at some of the material and see what excites you about it. The second thing is I wanted to share with you what we're doing here in the early stage research group is OHDSI recognizes we're really an interdisciplinary group. There's a lot of data analytics. There's a lot of software development going on within our repo. There's a lot of statistical methods being developed and being used for studying our network studies. And of course, there's a lot of clinical research domains that we're connecting the dots on in this process. And so one of our goals is to bring leaders from these four pillars, and they don't always fit within a pillar. Sometimes they might cross over barriers, and that's fine too. But we wanted to bring in leaders to help pull you up, to show you how to get more involved and how to get more out of OHDSI for your career. And so I just think, as a first step, I always recommend Eden. If you're new to OHDSI, Eden is the best place for you to go. Take a look at some of those frequent courses. There's a course on the OMOP data model and standardized vocabularies. And I think that really is a great one that I always recommend to all of my students. But then based on your interest, if you're clinical, the best way to learn about OHDSI is by doing. I also highly recommend the book of OHDSI is a great piece. It has a lot of practice and a lot of advice in it as well, especially if you're going through the ETL process. They have a lot, that was like a Bible. If you're having to ETL your EMR data into OMOP, it was essential. But then I think the way to learn OHDSI is to become involved with the work groups as a member. And the good thing about OHDSI is it's open and it's free. If I had a clinical background, I would recommend starting off with the phenotype working group, where we're really trying to define disease and how we're going to create different phenotypes based upon their coding profiles. And I think this is a nice group to help to see how the coding system can be used to build consensus around whether a patient is pregnant during a period of time or not. And so this is a good group. On the statistical side, I'm sure Jenna hopefully will be talking about patient level prediction, but I think that's a great place to start if you're interested in learning about statistical methods. If you're interested in software development, I see Katie, one of my Chirons is already here, which is great. I think the Chiron open source program is a great way to get involved with GitHub and all of the different repos that we have. And if you're interested in data analytics, I kind of think the best place to start is the data quality dashboard. Before you even jump into the common data model, it's great to learn about data quality tests that we do around it. And I think it's a good course. It's a great working group to be able to get started with. And so what you see, what we're doing here, what Faiza and Ross are doing here is we're bringing in leaders across these different disciplines and trying to show how they develop their careers, how they and how they could pull you up and give you advice on how to advance your career as well. The last that I wanted to show is this is a list of all, I think it should be about 28 different working groups that we now have within OHDSI. And I think people, are a little hesitant to join work groups, and I want to help you dispel that myth. So a lot of new people join these working groups all the time. And that's what they're there for. This OHDSI is an open science community, and it's open to all. You can join one or more or all of the working groups that you would like to join. They are all free for you to join. And what I recommend, I think great way to join a registry is if it looks interesting to you, just join it. And then when you join it, what you can do is you can watch the previous recordings. All the meetings are recorded on Teams. And then when you join it, you'll be added to the Teams tenant. You can look into their Teams group and see their discussions, their files. But in particular, watch the past 2 meetings recording. And if you want to blow the working group's mind, all you need to do is watch the past 2 recordings, write down some questions about those recordings, and then in the next working group meeting, introduce yourself and say, by the way, I've got a couple of questions about the previous 2 meetings, and then ask those questions, and you will be an instant favorite of that work group, because no one ever really expects people to listen to what we're saying in our working group meetings, and it's a great way to show your interest in the material, and it's a great way to just become involved just by asking questions. And so this is a nice way to help you get started. As you start, and we, for this grid here, trying to help you break down based upon whether we think it's a core function for data modeling methods and tools. We try to put our work groups into kind of like buckets is just one of our ideas of trying to think of how to organize some of our work groups, but each of them work on their own schedule. They usually get together at least once a month, sometimes twice a month. But these are all open to you to join and to participate with. And so this is something, we are a volunteer society and we rely on you to come in. And so we're always trying to welcome, introduce new members. And having said that, I would like at this time to say, is there anybody new on the call to our early stage research group that would be willing to introduce themselves to this call? We are a welcoming society, especially if you have any questions on how to get more involved in OHDSI. And Susan, so thank you for already introducing yourself from Loyola. Is there anyone else that's new to the early stage working group? I recognize several names from different working groups, so we can certainly get started. And with that, so feel free to use our chat or to raise your hand within Teams, and we would love to make this a conversation about how you can advance your career. So now I'd like to introduce the co-lead for the early stage work group, and that's Ross Williams. Ross is a doctoral student at the Erasmus Medical Center in the Netherlands, and he is his research focuses on the clinical and methodological questions in patient-level prediction modeling, and he's also a co-lead of the development pillar in Darwin EU and co-lead of Work Package 3, Personalized Medicine in the Eden Project. Ross, thank you.
Thanks, Paul. So, first of all, let me introduce Jenna Reps to everyone here who doesn't know her. So, Jenna is the co-lead of the patient-level prediction work group since 2017. She's also basically the leader of the patient-level prediction OHDSI R package. So if anything doesn't work, you can send her a message and she'll fix it for you. And she's got more than 10 years of experience working in big observational healthcare data. So welcome, Jenna. So the first question.
Thanks for having me here.
Right. So my first question for you is, what would you see as your major roles in your working life?
So my main job is I work at Janssen. So the priority has to be what I get told to do at Janssen. So I sit inside the EPI group, and then inside the EPI group, there's another group which is the analytics. So we basically deal with data. So a research question will come in, there'd be a protocol written up, and then there'll be some collaboration between the people who have the expertise in the therapeutic area and then the people who have the expertise in the data, which tends to be our team. So we answer questions on characterization, prediction, causal inference, and we need to think about the problems of, is the data suitable and what's the best methodology for answering these questions, and then actually implementing those studies. So that's my most of my day-to-day job really is that. But what we also do is we spend a lot of time in our group on the OHDSI stuff. So you'll see most of the team I'm in, you'll see their faces in OHDSI and on the GitHub if you look at all the code, because we create open source tools that other people can use, but also we use to answer those questions on characterization, causal inference, and prediction. Specifically, I spend a lot of time, as you see from this bio, in the prediction area. So I tend to get, if any questions come in that are prediction focused, that tends to go to me. I don't do as much on the characterization and causal inference. That goes to other people in priority.
Okay. Wow, that's fantastic. So my first question, I think, given that we're at the OHDSI ESR working group, let's focus on your sort of more OHDSI related activities. So my first question for you is, how did you get involved in OHDSI in the first place?
There's actually two reasons I got involved. So actually, the first time I really saw about OHDSI was more when it was like in this early stage. So OHDSI actually came from the OMOP group. So OMOP was a group that I think Martijn and Patrick and a lot of other people were involved in early on, where they were trying to actually just look at drug safety and come up with methods for causal inference. And that's actually where the OMOP common data model came from. And then that kind of expanded to OHDSI. So everything really started off as OMOP. And when I was doing my PhD, I was doing a lot of similar work with OMOP. So pretty much the majority of the papers I was reading was papers that were getting generated by the collaboration through OMOP. So that's where I kind of got to know everyone. And actually, when I first started, because I was just reading these papers, I was actually quite intimidated. So I can understand if there's new people, if you're intimidated. Like I was in the same situation like 10 years ago or when I was doing my PhD. Shows how old I am now. And then when I finished my PhD, I actually started chatting to Patrick about some work because we were doing some similar stuff. And that's when he introduced me to the, he said there's an open job. And then that also then got me involved in OHDSI, because our group, we do a lot for OHDSI. So that kind of pushed me into doing the patient health prediction part of OHDSI.
I think that's a really interesting point that you make about finding these people intimidating when you first meet them. I know I also had a very similar experience, and actually the first time that we met, I had a similar experience of, I think I was about 6 months into my PhD, and all that I'd got from my supervisor, for those that don't know, that's Peter Geinbeek here, was, you should read this paper by Jenna, you should read this paper by Jenna, you should read this paper by Jenna. And then you think, wow, there's this big name, there's this, this brilliant, smart person. How do I talk to this person? And then you turn up, and immediately as soon as you sort of start having conversations with these people, more often than not, they're really happy to just hear that you're reading their work, and they're actually really happy to meet you, because they really like you're asking questions about things that they've done, and the work that they do is what they're interested in, and people like to talk about that. So I think for people on the line, just know that I could say from personal experience with Jenna or with Patrick, if you just come up to them and say, hey, I have a question about this paper that you wrote, they are more than happy to talk to you about it. So I think, really, really nice, really interesting, Jenna. So my follow-up question then is, how do you see your role in the patient level prediction working group, and what do you think about the field of prediction in healthcare? And can you tell us a little bit more about that?
Yeah, that's an interesting question. So so my role in the prediction, so I was kind of one of the early kind of developers of the framework. So when I first joined Patrick's team, that's when the patient prediction kind of tool was starting to be developed. So there was a bunch of us. So Peter, Patrick, Martijn, Mark, I think, were the kind of original developers of the code, and it's kind of expanded. So Ross has been contributing a lot of cool stuff to the package. And then there's been a lot of, I see Eric here, he's been adding a lot, and Cynthia's been adding stuff. So there's been a lot of collaboration recently. It's been great, people have been expanding, but originally this got developed, I think, probably around 2016 is when we started it. So that was kind of just coming up with some basic stuff, but the PLP is always expanding. So initially we kind of restrict ourselves to let's do binary prediction. And we were just doing the metric known as AUC, so a measure of calibration. Discrimination was the only thing we were really focusing on, and we realized over time that we had to expand. So we had to add in calibration plots that were smooth. So that's what Ross added, because the reviewers were shouting us that's what we needed. And then we've had to add in some other things, so survival models. We've had to add in new metrics like net benefit. And we've been kind of getting lots of shouts about things, and PLP is just forever expanding. And I think that no one person really can do all this. So we really do need an army of people, and it's great. But we're starting to see, I think, a lot more people now contributing to the code, which is great. But I think there's still a lot of opportunities for more people to contribute, more stuff to be done. And if anyone on this group has an interest in something that's the PLP package currently doesn't address, so if it's not binary classification, we probably need you to help with the expanding that package. We've also, we had a work group originally. It got combined with the causal inference work group, but thanks to Ross, we're now actually bringing back the PLP work group. So you'll see, hopefully we'll have some adverts of that soon, and we'll be having probably monthly meetings where we can discuss different aspects. And as Paul was mentioning earlier, it'd be great to have people in here. And also, what I wanted to highlight from what Paul was saying earlier was, it's great if people are in multiple groups of those work groups as well, because it will bring in collaboration. So if you're someone who goes to the PLP and you also go to one of the other work groups, it's really helpful to have you on that call so you can say, here's what's going on in the other team, and bring that in, because sometimes I think the work groups can be separated. So if you're basically a member of multiple groups, that's really, really useful for us in any of the work groups, especially for the people leading the work groups, because we can't go to all of them. So I feel, in terms of prediction, I think like we tend to work a lot on trying to get best practices. We have a lot of methods research on that, but there's still a lot more methods research to be done. It's never ending. You open one door and then you have like 10 more doors open, or things that you wish you had done, or things that you now need to explore further. So we discuss that in the work groups, and we also then try and bring that into the tool that we have. For those of you, I don't know if you know about the OHDSI tools and stuff, but we have a GitHub repository where we put all the code, and then people can add on their own stuff. And it's encouraged that if you're using it and you have new ideas and you're able to add to the code to add it, if you're someone who doesn't have a background in programming, but you have great ideas, please post those and tell us what you would like. And someone who has that background in programming can hopefully then add that. So I think we need all these skills. We need people who can code. We need people who have the good ideas. We need people who have the clinical applications. In terms of prediction for healthcare, I think that at the moment I've been a little bit disappointed in terms of we do a lot of models, but we don't see a lot of clinical uptake of those models. And I think that there's one key area we need to focus on is how do we get these models used? And how do we make sure we're developing models that are useful? Sometimes people focus on the deep learning or the cool methods more than the application. So I think that one thing we need to do in the PLP work group is actually make sure that we're doing these cool methods still, but we're doing it for something that's meaningful, and not just as an experiment to show we can get a 0.001 improvement in AUC. So yeah, I've been a little bit disappointed in the current application of prediction in healthcare, but I think that there's a lot of opportunities. But we need this collaboration, we need the best practices, we need the methods, and we need the clinical applications that are going to add value as a focus.
Excellent. So I think there's a lot to cover there. I will actually quickly say on the note that Jenna made about helping to contribute to the GitHub or adding code, there's also within OHDSI, so I know Paul and Adam Black have been putting together a series of tutorials that's basically how do I create my first commit to the OHDSI code base. So if you know how to write some R code, or you know how to write some SQL and you think you can help out, but you maybe don't have much experience with GitHub or with workflows, then that's a great place to start and to take a look at. And then if you want to come and add something to the PLP package, then Jenna, myself, other people within the team are more than happy to sort of walk you through that process.
Yeah, I was a beginner with GitHub like a few years ago, and I have to say, like I did a lot of bad stuff, and I wish I'd had some help. So feel free, if you ever have any questions, feel free to ask, because I know when you first do GitHub, it can be quite intimidating. The same as, like I was saying, with like everything in Odyssey, initially it can be intimidating, but there's people that are happy to help and happy to chat. So yeah, don't be afraid to ask for help.
Yeah, and I think also the good thing about GitHub is you can never go too wrong with it. I know that the worst I've had to do is to delete something from my computer and reinstall it. But don't worry that you're going to manage to break something, and then Jenna and I are going to fly to wherever you are and come and annoy you because you've broken our code base.
You won't believe how many times I've deleted and just reinstalled things. So many times. Still these days, I still do that.
Yeah. So you mentioned there that you're a little bit disappointed with, say, the amount of uptake within the clinical field. Do you have some ideas about why this is? Is this because we aren't doing the correct research, we're not doing things in the right way, we're not communicating it in the right way? Do you have any thoughts on that?
Yeah, so I think there's numerous issues. So in the literature, there's been a lot of reviews people have done about how the majority of models have some sort of error. It can be criticism of the data. So if you develop a model using like data that's retrospectively collected, then often that's large. And you've got this kind of like really nice size data, but there can be issues with like missingness or bias. So like our data, we have a lot of issues that we have to account for, and you don't know whether the model trained in our data will transport over to a clinical setting. And then you've got the prospective collected data that people think is the best data. So if someone says, I want to do this prediction, I'm going to collect the data that has all the predictors that I need, that I know are meaningful, and all the measurements I need that I know are meaningful. One, that takes a lot of time, but two, it's often really small samples. So then you end up with a situation where you can't really do a very complex model. So you've kind of got these barriers in both kind of types of ways of doing the prediction. So I think that's kind of one thing. It's kind of like the data size with the good data, and with our data, you got the size, but you've got methodology issues because of the bias in the data. And then I think another issue that kind of stops clinical impact is people often who are developing the models, and I know I was like this because I came from a computer science background. I didn't necessarily always think about the importance of designing the prediction to be thorough. So I would say, I want to do a model, and I want to do a deep learning model to predict hypertension. And I would just take one code of hypertension and find everyone who had that. And then I would create some population, maybe a case control design, and I would develop a model, and I'd be doing the best practices for machine learning. So I'm doing my test train validation splits, and I'm doing a very thorough hyperparameter search and stuff, but I wouldn't necessarily be creating it with the best data. And then if you've got junk data, your model is obviously going to be not the best. So I think that's one problem that sometimes happens. And then I think the third issue is that sometimes people actually there's like a barrier of, if you are developing models in one data set, will it transport to another data set? So a lot of the times when we're doing prediction, we want to have models that clinicians will use. But if we're developing it, and I think this kind of goes a little bit, I guess, back to the first one, if we're developing it in the claims data or the EHR data that has missingness and potential biases because it's retrospectively collected, you don't know whether it's going to transport. And asking a patient, are you a smoker, is very different to saying, do you have a smoking record in your database? Asking someone if they have diabetes is very different to trying to phenotype diabetes in our database. And I think Odyssey is actually doing a lot of improvements where we're doing the phenotyping work. And I think this is something that we've realized because we've kind of developed models, for example, and we've realized that actually, what do these models really mean and how do you apply them? We realized we need good phenotypes, and we need to actually look at the quality of the data and how we're actually defining things. So I think that's why it's great that there's a lot of push towards the phenotyping. There's this phenotyping work group, and we're getting some good phenotypes. I think that's needed, and that's going to help us to get these meaningful models. But there's lots of different barriers, and it's good that Odyssey is probably one of the collaborations, I would say, that's pretty leading and trying to overcome as many of those barriers as possible. So we're doing the best practice to overcome the issues with the data. We're doing the phenotyping to try and make it so that our data is meaningful and our predictors are meaningful. We're doing the quality, kind of investigating the diagnostic quality. Is the data suitable? Is the model design we're doing suitable? And is our performance good enough? So we're kind of addressing a lot of these, but it's still there's this barrier, and we need to come up with a process to evaluate whatever models we develop clinically.
Yeah, I think that's really, you made some really good points there. I think a couple of key takeaways for me is one, just really emphasizing the collaborative aspect that we need to take in the approach to this research. So any one person cannot be an expert in all of these different things. And so, like you say, from your own experience, that you've started out by sort of saying to yourself, okay, I need to get some cohorts of patients. I'm just going to take the code for hypertension. And I know I did a very, very similar thing. And then you realize, actually, as much work, if not more work, needs to, particularly now with the excellent framework you've built for actually running the PLP models, almost more work needs to go into developing really good cohorts to extract the patients from your database to then train the models. But being able to develop a good cohort is a completely different skill set to being able to use that cohort and develop a prediction model. And this is, I think, where we really want to emphasize how, and I think something that OHDSI really facilitates is opening up this collaborative research. And I know my experience from like working within OHDSI is that when someone has come to me and they've said, oh, I've got this criticism of a study that you've done, their next question is almost always, and how can I help to fix this? And that it's really nice to exist in a community where you have this ability for people to both be critical of your research, but you also know that if you then ask for their help, they will then come and help you support them. And I think this is also something where we see like the push for the work over the last sort of 6 months and a year on the phenotyping work group and the creation of a phenotyping library. Although I think the people that are running it also acknowledge that is not then a perfect solution. It gives you such a much better starting point. And I think particularly if you're at the start of your career, it's nice to sort of play around with some models. And if you can then use a pretty decent cohort instead of using, a single code cohort, that's already giving you such a leg up and such a step up that it really gives you sort of a fantastic opportunity to do this. I think the other point I thought that you made that was really interesting is making sure that we have sort of a good application of the model when we do this, and making sure that we sort of, I think, communicate with the people who are going to use this model rather than trying to go in and tell them something. Paul?
I just had a different question for Jenna, but I wanted to get back to her training a little bit. I wanted to know, in your classical training, what were the most useful things and topics that you were taught that you use today in OHDSI, and what were the gaps and that you weren't taught in your classical training? You mentioned one of the gaps already was practical Git and open source engineering methodology, but I was just wondering about what are some of the strengths about your training that helps you in what you do today, and what other things you had to add on to that?
Yes, that's a great question. So I would say that throughout my PhD, I learned a lot about supervised learning. So the process of how do you actually go from data to getting a model. But I think that I didn't, before I kind of started at J&J, I didn't necessarily have the best methods for creating that data. So as I mentioned, I would just use like one code for hypertension, or it would be a very kind of quick and easy way of creating data, but not necessarily the best data. So that was one thing where I had to learn more of like the epi perspective of making sure you've got thorough data. And I remember actually when I was, after I finished my PhD, I started.
Do you mind mentioning what your PhD and what your bachelor's were in?
Yeah, so my undergrad was actually mathematics. Then I realized that I liked applied maths. So I went on to do a mathematical biology master's. And that's when I realized that in math, so they didn't have any data. So it was always like, I'm going to do a simulation or have this model, and I'm going to just be like, well, here's all these parameters, but we can't really estimate them correctly because we have no data. So I'm just going to look at the literature, see what the literature has. And it was kind of frustrating because you're like, you've got this complex model, you don't have enough data, and you can't really gain anything meaningful. So then you have to simplify the model to come up with meaningful insights, but then you're not really capturing the complexities of the real situation. So that prompted me to move over to computer science. And I actually asked, do you have data? And they said yes. And then I actually got bombarded with data. So computer science, they actually had too much data. But that's pretty a much nicer problem to be in. So that's when I started actually working on a large UK medical database. It's called THIN, which some people probably have heard of CPRD. THIN is very similar to CPRD, so it's the general practice records of the UK. So it has when you're in the UK, you generally will go to your GP first, and your GP will funnel you to other kind of like specialities or to the hospital. And when you see your GP, they enter in anything that you kind of tell them, and they should actually enter in a lot. They're supposed to be good at entering in the records, and that goes into the database that I was using. And then also they can give prescriptions, and that gets put into the database. But there is this issue with the database I was using, that you could get given a prescription, but you don't necessarily have to actually take it. So you don't know if these people are actually taking the drugs and stuff. But I was using that database that I think had about 4 to 6 million patients. It was a pretty big database to try and do signal detection. So it was the epidemiology department said they had this database, and they'd been doing very thorough stuff, standard epi. But one of the professors said it would be really cool if the computer scientists can just do their big data analysis and get something for us. So they just gave us the data set and just said, do your computer science magic. But then we realized after 4 years, I then started speaking to other people in the epi group, and that's when they were saying, oh, you should be actually being more thorough in your definitions of everything, and you should be basically reducing the issues with the data. So I kind of learned after my PhD that I should have been doing more epi stuff. And it was like Ross was mentioning, it is like a collaboration. It's like computer science can do the models, but you'll have this gap potentially with the creation of the data unless you speak to the epi, and then you don't really go for useful questions unless you speak to someone who has the medical insight. So you really do need this collaboration. But yeah, so my background was maths and then computer science with the big data. So it was I kind of moved over towards OHDSI as I progressed. And then other things that I think that I was lacking. So yeah, I didn't, because my PhD was in computer science, that actually is more like a applied maths degree. So it's more stats. And so I didn't have the GitHub experience. Like no one taught me how to use GitHub. No one taught me how to use R. Well, I knew how to use R packages, but no one taught me how to develop R packages. So that was something I had to learn. And that again was something that I thought was going to be really difficult, but actually ended up being pretty easy. If you can write R code, you can write R packages. It's just making it into functions.
And I imagine the Boolean math of SQL appealed to you as a mathematician.
Yeah, SQL, I really enjoyed that. To me, I think of it like a matrix. So when I'm doing SQL, I actually think of matrix multiplications and such when I'm doing it. That's my little like hack of SQL.
Can you talk to us a little bit about how you got your first job after your degree? How did you translate your PhD into a career? Because it can be very hard. I'm trained in physics, so it can be very hard to go from a sciences into an actual career.
Yeah, actually, that's a fantastic question. So I remember after I did my maths degree, I thought maths, like we're told that you should open up lots of doors, and it opened up lots of doors, but also kind of limited you because you have the tools to answer a lot of questions. You can go into finance, you can go into healthcare, you can go into a lot of areas, but you don't have the expertise in any of those areas. So I found after my maths degree, it was really hard to try and find a job because you were starting from scratch on everything. But when I did my PhD, because I was then focused in this healthcare with big data, that kind of then gave me that expertise to stay in this healthcare field with big data. And fortunately, it's exploding that area now. Everyone kind of wants people to be working using the big data to try and gain healthcare insights. So after my PhD, because I had been working on similar projects to what the OMOP team had been working on, that's when I got connected to Patrick, and he just happened to have a position in his team. And then fortunately, I got to join his team, and that kind of got me involved in OHDSI.
Yeah, that's great. Well, it's nice that you're able to focus during your PhD to gain marketable skills as part of that. That doesn't always happen.
True. Yeah. So yeah, I mean, I got lucky that that I did my PhD in the big data of healthcare. I think that was definitely it kind of made my path a little bit easier.
I see, Susan, you have your hand up. You have a question.
Yeah, I have a question. Actually, we share a lot in common, Jenna. My original bachelor's was in mathematics, and then my master's is in computer science. And I've been working in the healthcare industry on and off, not necessarily in the computer science area, for almost about 40 years. I worked in physicians' offices, was in charge of the physician billing in the US, and then I got into the healthcare and the big data. One of the things I found that I think a lot of researchers, when they're extracting data, have a hard time is actually getting people to work with them that actually understand the whole process of the healthcare. It's not just the diagnosis codes. It's not just that a lab was done. It's not just a result, but what is the process that people actually go to from the time they walk in the door till the time they leave? Because a lot of people don't. I know I found on our end, and we're working with a lot of simple things that could influence a predictor, because we have done some NLP in that, and I'm one of your SQL per se experts in there. And I've developed several clinical applications. Prior to going to Epic, I created a anti-Coumadin system that we use to treat our patients in our Coumadin clinic that they used for about 15 years. Have you found the same thing, that it's hard to get somebody that knows what the patient goes through from the time they walk in to the time they leave, and what the physicians are doing in the meantime?
Yeah, so I think we're kind of lucky in our team that we have people from lots of different skill sets. So I know Claire Blacketer, she actually worked on like the insurance claims. So she actually had like a really good background of how that was done. And I think other people in our team have had experience with different aspects of kind of how the data has been collected. So we tend to learn from those, and our message. So if I don't really understand something, I'll message someone and say, do you know like how this is, or is this data space suitable? So I ask a lot of questions for the people who have the expertise, because I don't really know necessarily how that data is collected, and it's different in every data set, and different in every country. So you really need that like local expertise for understanding. And this is one of the issues I think is the barrier for prediction modeling, is the data you end up with can be very different to reality.
Correct.
So this is one thing I think it's hard for me to kind of figure out how we can overcome that barrier when we're developing models and we're trying to discriminate.
Now, when you were talking about the implementation, I know on our end, we have a hard time getting some of these predictors, the models implemented into the EHR system, because you're dealing with totally different people to actually implement that in the EHR. And I think sometimes the priorities of the medical centers aren't, how can I say, they're not fast to jump on board with what we've discovered, because they're so used to their best practices that, if it's outside of the realm of what they're doing, are you finding a hard time? Because I know that's what we have. We have come up with several ideas to implement to create different scoring systems for alerts and that. And we've noticed it's very hard to get anybody in the EHR to actually implement that, where we went outside of it and tried to develop application and tools that will notify as fast as we can, but it would be a lot better if they were notified in the EHR instead of getting an email the next morning that says, hey, the patient may have ARDS, you might want to check them. So where if it was implemented in the EHR, they could get the notification as soon as the lab values are generated.
Yeah, so unfortunately, we've not actually been able to try any kind of application models in the EHR. I think this is what I'm excited about. But like you said, there's this barrier. And also, I hear sometimes like some clinicians seem very keen to have models implemented, and then some say that they get so many alerts, so they just kind of try and mute everything. So I think like trying to get the models used is a big barrier, and we haven't actually ever got that far. So I feel like the closest we've got to having a useful model is the seat cover model that Ross was leading, where we basically just created a score-based model that people could go to a website and enter questions, but that wasn't integrated into EHR, so it kind of bypassed the issue of trying to figure out the EHR. And I know we've been working and chatting with Jose, he's a professor in Columbia at the moment, but he was at Stanford at one point, and he was saying about how when he was trying to get models implemented there's issues if they're too complex and if they go into too many tables. So we were chatting with him of trying to figure out ways to overcome that. But unfortunately, I don't have the experience of actually getting anything implemented yet, which is something why I'm probably a little bit disappointed about things at the moment. But I'm hoping in the future we can actually start to progress there and do some research and figure out how to get engagement, and how to actually make it so that it's a little bit more streamlined, and how to make it so that clinicians would be interested in them.
Yeah, Jenna, so now
excellent.
you've moved into my wheelhouse, into informatics. When it gets into how do we deploy AI models into clinical care, how do we make it learnable, explainable, how do we have it integrated into clinical workflow with a seamlessness that's able to really improve the process. So yeah, so it's one of the fun parts of us being a multidisciplinary community where we really have different pieces of it where really now we need the clinicians and the informaticists to build products that can take evidence generated with OHDSI and create decision support tools that are integrated in real time with FHIR into interoperable, clinical IT systems. And so that's, but it is exciting to see that beginning to come to bear.
Yeah, I'd be probably sending you some messages to be like, how do you see this being done? Or hopefully like we can get you to come to the PLP work group once we got it started. You can give us your insight on that.
Yeah, actually, I just gave a talk to the ONC HIT group here in the US around how I see FHIR and OHDSI. This is where the OHDSI and FHIR groups are really doing a lot of collaboration.
So Jenna, actually, I picked up on one thing you mentioned there. So you talked about Jose, and so we've worked with Jose quite a bit. But you mentioned, he was at Stanford and he's now in Columbia. So one thing I wanted to get your perspective on, being someone that has, moved countries for a job or for a position, and I think we know that within science, sort of mobility is actually going to be quite key to sort of progressing in your career. How did you find that process, and do you have anything that you want to share with people? Maybe someone that's thinking about applying for a job, but they're thinking, oh well, it's maybe it's in Europe and they live in the US or elsewhere, or maybe they're in Asia. How did you find that process, and do you have any advice for people thinking about that?
This is another good question. So I think it can vary a lot depending on the situation. So I you moved as well, Ross. So yours was pretty harder because you actually moved to a country where English wasn't the first language. With actually, I guess like British English and American English are more different than I realized when I moved over here. But yeah, so I actually found the move was pretty easy because I was fortunate that the J&J basically gave me a package to move. So they actually helped me with the whole process. They helped get me integrated. I had the I'd spoken to Patrick and he was interested in me getting the job. So he helped a lot for me to move. So that kind of, there's one barrier. I think if you want to move countries, sometimes it can be hard to actually get visas. And if you're applying to a job that you're not from that country, sometimes you're not eligible. So I kind of had that pretty easily done because Patrick was always already interested in me having this job. So he kind of like made that possible, and J&J is a global company. So that kind of blocked that barrier. If you're someone, for example, in England right now, and you're applying for jobs in the US and you don't have kind of someone who you're just applying, then chances are you're probably going to get rejected straight away just because you're not eligible. Most of the time, you have to be a citizen or a green card holder. So if you really need to do research to make sure it's feasible for you to move. And if there are barriers, you need to think about how you can apply and get the green card or the visa or whatever it is you need for the country. If it's feasible for you to move, then things to consider would just be time zones, I guess. So when you move, you're in a different time zone. So friends and family, it can be a bit harder to chat with them. Like I'm 5 hours behind in the US. So by the time I finish work, it's 10 p.m. in the UK. So it kind of makes it sometimes a bit hard if you want to chat to people from the country you came from. But in general, I think it's pretty easy because you've got things like Zoom and Teams and FaceTime and stuff. It's pretty easy to stay in contact with people. So I haven't really found that it's been difficult in terms of like distance from family, because I just chat to them whenever I want through FaceTime. There is pretty a different culture, I guess, when you work. So the UK culture is a little bit different than the US culture, and sometimes when you move over to the job, you may not necessarily realize that straight away, or things might surprise you. Like I said, the language barrier was an interesting one. So there's words in British English that Americans just wouldn't understand, but no one told me for many years. So people just gave me blank looks when I was saying stuff because they didn't understand what I was saying. But over time, you learn that, and you will eventually get people that tell you like that doesn't make sense in American English. we use this word instead. Or you'll just get wrong coffees. That's what happened when I first joined us. Like I'd try and ask for a latte and they'd give me some random like mocha or something. I'm like, I don't even know how my accent's doing this, but that would happen sometimes. I think that when you change and you move abroad, you do learn. Like I feel like you get that it is a good learning experience, because it is good to kind of work in a different kind of culture. And it's like in England, I wasn't very good at being vocal, so I was quite a kind of introverted person. I feel like in the US, it's kind of helped me where you I don't know if it's just because people are more encouraging. In the UK, they're a bit more like negative. But I feel like now, it may just be because I've got older, but I feel like I speak out a little bit more now, and I'm still introverted, but I would say that I'm much more kind of comfortable speaking up and such now. So you do kind of develop, and I think that's a good experience of moving countries. But in general, like the fundamentals are the same. So you'll have a group of people that you work with. I really like that my team, you're going to have that wherever you are. And then your job is your job, and like that never really changed. I worked in the UK and the US with my job. The type of thing that I was doing was the same. So I think a lot of it is kind of pretty much the standard wherever you are. I'm curious to hear your perspective on it, Ross, because you moved obviously within Europe, so not too far, but the different language.
Yeah, so I obviously I don't have the time zone issue, because it's only a 1 hour difference. But yeah, the language barrier, even though, I mean, people that have been to the Netherlands don't know that the standard of English here is excellent, and you can basically exist here without having to learn Dutch. I definitely found that once I learned the language and got up to a fluent level, it much improved my experience here, and I much more enjoyed myself. And I think for me, the most important thing I had was when I first moved here, I came with the perspective of this is going to be a bit of an adventure. And if after 6 months or a year, and I thought to myself, you need to give it some time, because there's going to be some sort of adjustment. But if you're really unhappy, you're not enjoying it, then you need to express that, and you can always leave and go back. I think I always had this idea of like, I'm coming here as an adventure, to further my career, to sort of develop myself. But there is always the opportunity, if you really don't like it, you don't have to stick it out. So it's to have this sort of almost a sort of like a playful mindset when you move, and just accept that you're going to make mistakes. People aren't going to understand things that you say, and you're going to get things wrong just because you don't have that sort of immersion in the culture. But I know for me, it was a really good decision. And I think I have the idea for you as well, that you see it as a really good decision. I just thought it's nice for people to hear this perspective. I think we're coming towards the end of the meeting, and there's 2 questions I want to get to you, which is one, if you could go back to the beginning of your career when you're either, and this could be when you're choosing what bachelor's you want to do, or choosing what PhD you want to do, or choosing a job, what bit of advice would you give yourself? And then the second one is, if you have any opportunities within your group, there'll be a little moment at the end for you to share that with us.
That's a tough question. So I guess like in terms of my career path, I'm pretty happy. Like I feel like a lot of what I picked actually did open up the good opportunities, and it was the time where big data and healthcare is kind of expanding. So I was kind of fortunate in that. I guess when I was doing my degree, I wish I had kind of maybe thought about more like useful applications. So a lot of maths is you just got a problem, you solve it. And then you kind of forget about that. So I feel like a lot of what I did, like you learn, it was kind of good to just see the perspective and kind of like more like philosophy of like how you go about solving a problem. But if I got given a task that I had to do during my undergrad now, I would fail it miserably, because I didn't know how to do most of the maths I was doing back then. So maybe if I told myself to just kind of keep it up and then keep doing it, so that it isn't something that's kind of like now lost to me. And I think that maybe I would have, if I could have, I probably would have liked to have been more involved in kind of like the theory and the development of new methods. At the moment, I would say more I'm just someone who applies what's already there. So there's machine learning methods that people have developed, I apply it. It would be really cool to be able to develop the new methods, or do some method development in terms of like adding new things to deep learning, or adding some new tree-based model or ensemble or whatnot. And in that case, it would have been, yeah, I should have basically continued up my skills in maths, and I haven't. So that was probably what I would tell myself. And then I guess for progression for jobs, as I said, when I finished my maths degree, I feel like I was really unprepared for a real industry job. You don't really have the skill sets. You haven't experienced, like you haven't joined meetings with groups, and you haven't done presentations that much and such. So I guess gaining those kind of life skills is probably something that I would encourage like people early on in their career, like try and like develop your ability to do presentations and give presentations as much as you can. If you can do a summer internship where you can get the experience of actually joining meetings, and just the etiquette of when you join, you introduce yourself and then you put yourself on mute. I guess like OHDSI is really good because OHDSI meetings, you'll get those skills. I didn't have OHDSI when I was doing my undergrad and my PhD, so I never really gained these skills. It wasn't until I joined, and they're not things that take you forever to learn. Like you'll pick them up pretty quickly, but I guess it will make it a lot easier transition to a job if you gain these skills. So I actually think OHDSI is probably a really good resource to gain a lot of the skills that you would need for industry or even academia.
Yeah,
And
I would definitely agree that OHDSI is a good place to gain those skills. I know that a lot of the first I think even the first presentations that I gave were in the PLP working group back in 2018 now. And I think I know that giving that to then still an international community, but a smaller community really gives you the confidence.
Yeah. And then in terms of opportunities, so J&J generally has a lot of jobs available. So there's like if you type J&J jobs, you'll get like their job board. There's a lot of different teams, and some of the teams I will have like no knowledge of really, or I don't see the people. In terms of my team, in the EPI group and ODA, I don't believe we have any positions open right now, but I asked Patrick and he said there's the potential that there will be opportunities in the near future. So if people are interested in ODA and J&J, then he actually said he encouraged me to ask for CVs. So if you're interested, basically look, and normally we advertise on the forums as well. So that's a really good resource for all the people who are connected to OHDSI will advertise jobs on the forums. So I'd keep an eye out on those forums.
That's fantastic, Jenna. Thank you so much for joining with us. Paul, I will hand the floor back to you if you want to close off the meeting.
Yeah. Thank you so much. And I agree that was a fantastic discussion. So just wanted to let people know next month we have another great speaker. So in October, we're going to have Dr. Jennifer Lane from the University of Oxford talking about her career. And she has a clinical background. She is a surgeon, and she has, we're going to talk about how to lead your own network study. So really one of our major goals is how do you be able to combine data from across institutions and to lead a network study. And she's going to walk through how she was able to do that with University of Oxford and about 6 other partner institutions. So thank you and have a great month.
Thank you.
Thank you.
Thanks a lot, everyone. Bye-bye.
Yeah, take care.
Bye.
Thank you. Bye.